Okay, it's Jared Moore again with Mvskoke Media, and this is Live Wire, the program where we take your questions from the chat. So if you want to ask a question, today's topic is the Omicron surge and the Creek Nation Indian Health System. On our program today, we have Dr. Larry Vark. He's right above me here. Dr. Vark, thanks for joining us today.
Thank you very much for having us.
He is Deputy Chief Medical Officer. Also, we have Shoneen Alexander Ross. She is Chief Performance Officer. She's right here, right here.
Hi, Jared. Thanks for having us.
And then we also have Kara Lee. She is the Health Administrator for the Okemah, Okmulgee, and Wetumpka clinics. She is up in this corner.
Hi, everyone.
Okay, so with that being said, I want to remind the audience, if you have a question, pop it in the chat, and I'm going to go ahead and start off with, we've seen a lot of news coverage recently about the Omicron surge and the numbers going through the roof, and also how it's impacting local hospitals in OKC. And I guess this would go to Ms. Lee. How is what's the status of our clinics right now? How are they doing? Are they overrun? Are they good? Can you give us kind of an update on that?
Currently, we are doing well. We're managing it. Last Monday, we opened up a drive-through testing center, and that really helped alleviate some of the traffic flow of coming inside the clinic.
How is the staff doing? Is morale good?
Morale's pretty good. We do get tired. We've been fighting this for a little over 2 years now. So just they keep picking up and coming to work every day and doing what we need to do to fight this pandemic.
In the process for citizens, if they want to go into a clinic to get tested or vaccinated, has anything changed specifically because of Omicron? We've done several updates, so I think citizens kind of understand what they need to do, but has anything had to be changed specifically because of Omicron and the new surge? And this is for everybody.
Well, really the only thing that has changed for us is we were doing all the testing inside the clinic. But with the surge that came at the first part of January, we were overflooded. So that's why we decided to open up the testing centers. And it enabled patients to come through in a more efficient manner.
I see. I'm going to move to Dr. Vark now and ask a question that's kind of been covered in the media a little bit, but I wanted to ask your opinion on it. There's been a lot of coverage saying that, or implications that Omicron is less lethal or different from Delta in that respect. Could you kind of touch on the differences between the Omicron strain and the previous strains we've seen?
Sure. With regard to Omicron, the research is still ongoing. However, Omicron has been found to be quite a bit more contagious than previous strains. That means it's easier to get infected by Omicron, probably 2 to 4 more times as contagious as the Delta variant was previously. Measles is one of the most contagious viruses that we know, and Omicron is nipping at its heels as far as being as contagious as measles. It does appear that, as far as severity of disease, that Omicron is a little bit less lethal. I pause a little bit with that because, yes, a lot of people are getting primarily upper respiratory symptoms, sinus, stuffy head, maybe a little bit of cough. However, Omicron still makes a lot of people very sick. Yesterday there were 150,000 people in the nation that were hospitalized with Omicron because it constitutes about 99% of all the COVID that's going around right now. So yes, for a lot of people it is less lethal, but it is still a potentially very dangerous organism, and people need to take it very seriously.
Okay, what are the recommendations right now from the health system as far as what citizens or patients can do to protect themselves? What's the checklist that we would give out?
Well, principally, there are several mitigation strategies. That's what we call them. Mitigation strategies, or strategies that are designed to reduce your risk. Of course, the old standbys, I think that everybody's getting a little bit tired of, is, wear a mask, wash your hands, socially distance 6 feet. But really, we have found, I so wish I could convince everyone to get vaccinated. Over 90% of all the people that are in the hospital today with COVID are unvaccinated. Vaccines do not always prevent you from getting COVID, but what they do, and what they were really designed to do from the very beginning, is to prevent you from becoming seriously ill, hospitalized, or unfortunately passing away from COVID. And it appears that even with all the variants, the vaccines are doing a very good job at that. At this point in time, we advise you getting your 2 initial vaccinations, and if it's been 5 months, please get a booster shot. That is so beneficial, and it will save so much anguish amongst families. We have it's so sad. We have seen so many funerals in the last 2 years of our Creek citizens, and it's vaccination, it's not a panacea, it's not 100% effective, but it greatly reduces your risk of serious illness and hospitalization. I just cannot stress vaccination enough.
Okay.
Now, Dr. Vark, and I would add to that too, if you start to experience symptoms, isolate, get yourself tested. If you have a home test, and it shows up positive, assume it's positive. If you're still experiencing symptoms and you get a negative, follow up with testing. But it's important that if you're symptomatic, isolate. We don't want to continue to spread this virus to the vulnerable populations that we have in our communities. So that's a big part of it.
And this is a broad question to everybody, but has there been any projections, or does anyone have any idea when we will see the peak of this surge, or when we will see it turn around? Because there's been a lot of conjecture about, this is only going to last through February, or through January or February. Internally, do you guys see, what are your opinions, or is there an official statement on that?
Well, you have to be careful what you hear on the news, because a lot of what they talk about when they say that, the numbers are improving, that really has to do with a lot of the very large population centers on the East Coast and in the eastern part of the country. It showed up there first. And so, yes, they are beginning to see some decreasing numbers. We, however, to this point, have not seen any decrease, certainly not a significant decrease. I believe, and Dr. Dart, who is the director of the Tulsa City County Health Department, is also of the opinion that it's too early to tell exactly when we're going to peak. I hope it's the middle of February, but it's just really too early to tell at this point.
Okay. Let's see here. I want to again mention to everybody that's watching the program, if you have any questions for the staff here, pop them into the chat. What can citizens do specifically to help out the health system? I'm not specifically talking about, I guess we kind of touched on it already, mask up, socially distance, if you feel sick, quarantine. How can citizens get tested? We ought to probably mention that. I know we talked about the drive-up tested. What are all the methods that they can do through the health system? And this for anybody.
So I think Kara mentioned that we have drive-up testing that's available. So that's one option. And then, home tests are being talked about quite a bit. And so there are home tests that are available. Again, I think it's just to watch for the symptoms. If you've been exposed, continue to monitor yourself. If you start to experience symptoms and we want to get you in and get you tested, Like Kara described, we are trying to meet the testing needs by using the drive-up option because it's not only more convenient for patients, it can be much quicker too. So we're hoping to keep those drive-up testing sites open and to encourage folks to go seek their testing through that option. Of course, if someone is becoming ill, we want them to seek the care they need. But oftentimes, even in the media, you hear individuals, maybe they start to experience symptoms and then they present to the ER. That can cause some bottlenecks in our emergency rooms. We'd like to reserve the emergency room for the sickest of the sickest. I don't know, Dr. Vark, if you want to jump in there, but we tend to see folks seek testing in the emergency room in a non-emergent situation, and that can be problematic for those patients that really need that emergent care.
That is true, Shoneen. I just feel like there are more efficient ways that our patients can be attended to rather than having to go to the emergency room. It usually involves a much longer wait than at one of our testing centers or even in the clinic. Also, one of the big problems that we've had as a nation is that the heart attacks and the strokes and the kidney problems, they don't go away just because the emergency rooms fill with COVID. So there are people with other medical conditions that are very, very serious, some life-threatening, that will demand attention from the emergency room. If you have a loved one that is suffering from one of those conditions, you certainly want them to receive care absolutely as quickly as possible. So if you are short of breath, if you can't complete a full sentence without having to stop for air, if putting your clothes on makes you have to sit and rest, then at that point, maybe that is an indication for you to go to the emergency room. You're probably going to feel fluish with COVID, and it's not a fun thing to go through. But if you're not short of breath, if you're not having serious problems, I would seek care at one of our clinics or at the testing sites, because I think you'll get in and out faster, and we can address your needs in those places very well.
So with the drive-up testing, where specifically are those sites?
So Council Oak in Tulsa is one location where we offer that, and I wasn't sure if Kara was going to jump in. Okemah is another location where we offer drive-up testing, and then Oklahoma as well. If you're a patient at Eufaula, clearly you can contact the clinic there and see about the testing times as well. But those drive-up locations, again, are quicker and more efficient for our patient population. And we try to look at the southern region, the northern region, and then a central location like Oklahoma. So those three drive-up locations, we're doing testing every day.
And for those locations too, are those locations limited to like Indian Health System patients, or are those open to can anybody come to those drive-ups?
Anybody can
Community based.
Okay, so literally anybody can go to those drive-up locations and get a test. So,
literally.
Okay, and I guess I should also ask too, what type of tests are at the drive-up locations?
They're doing the rapid biomix now.
Okay, so with all that being said, I personally wanted to mention to all of you guys while I have you here, I appreciate everything that you're doing. I know it's been a long slog, and we're still two years into this, still having to deal with the COVID situation, and I know it's a lot of hard work on you guys. So I appreciate you coming today and dropping in via Zoom for the interview, and all the hard work that you do all the time anyway. So, and then I don't see any questions popping up in the chat. We're about at 15 minutes, which is a halfway point for the program. Is there anything that you guys think we should talk about that we haven't touched on yet in relation to Omicron?
Jared, this doesn't really relate exclusively to Omicron, but we are actually still seeing patients that have previously been tested positive for COVID that are still experiencing some symptoms and having a difficult time recovering. One of the things that we're working on operationally inside the Department of Health is to offer a post-COVID clinic to those patients that would still be experiencing symptoms that are related to COVID-19, maybe not recovering as quickly as what we'd like to see. And so that's something that we're trying to extend to our patients, is the opportunity to come in and be a part of that post-COVID clinic. I don't know, Dr. Vark, if you want to share anything more specific about the care and evaluation that's going on in that clinic.
Well, we know that the type of symptoms that people can suffer as a result of what we call long COVID can be extremely varied. I think probably the most common ones are what they call brain fog, just impaired, you just aren't quite thinking, you're not quite as mentally sharp as you felt like you were before you got ill. Some lingering breathing difficulties. Those are two, but the folks at the post-COVID clinic will run a battery of labs. They'll do a very thorough examination, and they will also make referrals for you to any other particular specialty that might be necessary. For example, if they feel like you have a significant lung problem, they'll get you to a pulmonary specialist. If some people have suffered from various heart difficulties, they will get you to a cardiologist, a heart specialist. So we're trying to make it a very comprehensive means of caring for patients. It's not an easy puzzle to unravel, but I think it's very important that we take a look at these folks that are suffering from these symptoms, so that hopefully we can provide them some relief, but also so that we can gain more knowledge about just what we're dealing with here. 2 years of COVID, believe me, it seems like forever. But in scientific terms, that's not a long time to have had to study a disease, especially one that has changed as much as COVID has over the past 2 years, with the variants and the differing symptoms and the surges and the lulls. So the more that we can learn about this, I think the better prepared we are to continue. I'm afraid that I think COVID's going to be here for a long time. Will it be like this? I certainly hope not. But I just don't know that we're ever going to be able to get rid of COVID. So the more we can learn about it, the more we can manage it, and hopefully get back to some type of normal like we had prior to all this starting up.
Well, I think it's very interesting that those are going to be offered, the prevalence of long COVID. There's been a lot of articles written about the study of it. While we were talking about that, we actually had a question pop up in the chat from our very own Gary Fife. And for the audience, Gary Fife is the host of Muscogee Radio. He asks, are children included in vaccinations now? And that's for anybody.
So we've been extending vaccines for COVID to our pediatric population for, I want to say, quite some time, but since the emergency use authorization was approved, and so that's been about 2 months, I think, Dr. Vark. You'll have to time check me there, but we are able to vaccinate those individuals that are in the pediatric population at any of our facilities. We do like to do that by appointment, simply because some of those youngsters are smaller and they may need to be provided the vaccination in the thigh, and so we want them to be engaged with our pediatric staff to do that. Clearly this is something that we're promoting, and we encourage the parents, if they have questions, come forward and talk to our pediatricians about those. we'd like to see as much of that pediatric population vaccinated as possible.
And correct me if I'm wrong, I just want to interject a little bit. That's for, I believe we're only approved for, is it 5 and up or 4 and up?
5 and up.
Okay,
Yes, 5
so
and up.
so
Yeah,
we're
thank
still,
you for putting that in there. Yes, 5 and up.
okay, so we're still waiting on the approval from the FDA and the CDC on the under that vaccine,
Yes,
the younger. Okay, so anybody watching the program, if you have any questions, pop them into the chat, just like our friend Gary did. We're at the 20-minute mark, so we're getting close to wrapping up here. I'm going to go for a couple of more minutes, so if you got a question, go ahead and pop it in there. The Omicron surge, I think, Dr. Vark, you were kind of touching on how everybody now seems to think it's going to become endemic. I guess that's a foregone conclusion now. What will a new normal kind of look like, or is this? And this is just we're just conjecturing here, obviously, but is it something where masks are going to become something that people are going to need to wear on into the future? You know, we've seen that kind of like after the bird flu epidemic hit Asia, you know, that became kind of a cultural thing that they would wear masks a lot everywhere in public, some people. So what are your opinions on that?
Well, I think as much as I'm no more happy about wearing a mask, I think, than anybody in the general public that is out there having to strap one of those things on every day. However, the studies do show that it does help reduce transmission of COVID. And interestingly enough, we have had 2 very light flu seasons in the past 2 years. And we feel like a lot of that is attributed to the mitigation efforts, the masking, washing hands, social distancing that people are doing. Flu has been, that's usually something that we're dealing with fairly significantly during the wintertime. And for the last 2 years, it has really reduced itself. So, I guess it depends on the research, what type of, if there are new and improved vaccines perhaps that become available, if there are additional therapies, particularly in the form of a pill, that might be produced on the market that would help. Influenza not too long ago was one of those things that you just had to tough out. If you got really sick, you went to the hospital, but then came along some oseltamivir, which is a flu medication in a pill form. And so that has drastically changed our treatment options for the flu. So hopefully something like that will come along, and maybe it'll be something that we'll have to be careful about, be aware of, but there'll be an oral therapy that can be used if somebody happens to come down with COVID.
That's awesome. Well, thanks so much, guys. I do want to mention to the audience, I kind of popped the chat up there. Shoneen had posted the address, and that's for the Council Oak Comprehensive Healthcare Center or post-COVID clinic. And so that's the address there. You can email them at that email, and then I'm assuming that other link, the creekhealth.org link, is the locations for the drive-ups. Is that correct, Shoneen?
Actually, that's locations for all the vaccinations that we are still offering across all of the sites. So that's the most recent link there on our website. You can always follow creekhealth.org or go check that website out and find all of our information. And you're right, Jared, I did share the post-COVID clinic information. So if someone wants to schedule, they can call 918-940-7542 extension 5728 and ask about being scheduled for the post-COVID clinic. And then follow us on social media, also Muscogee Nation Department of Health. We try really hard to make sure the most current information about drive-up clinics for testing, that's always pushed out. And we're also sharing information on how you might protect yourself, what our recent positivity has been, and things like that that's relevant to our patient population.
Awesome. Well, thanks so much, guys. I think I'm going to go ahead and sign off. I don't see any questions. I want to give a preview to the audience. Next week on Thursday the 3rd at 6 p.m., we're going to do another live wire. And this one's going to be about decolonized Decanter, and that's from Decanter, Georgia. There's a group there that is looking for Creek artist submissions for a public artwork project to replace a Civil War cannon that was taken down. So we're going to have 2 people from Decolonized Decanter on the program. So if you like the program, tune in there. You can ask them whatever questions, and we will see you guys again in the future. Dr. Vark, Shoneen, and Miss Lee, thank you so much for joining us on the program, and we will tune in. Hopefully we won't have to do another update on the COVID, but if we do, I look forward to speaking with you guys again, and thank you for all your service.
Thanks.
Thank you.